One of the things when you have a serious illness, or if you've had a stroke, a brain injury, a spinal cord injury, fallen and broken your hip, is to remain optimistic. And what physicians always walk that fine line when they're talking to patients is, how do I remain realistically optimistic? I don't want to give you false optimism, but I want to be realistic about it. I like to surround myself by optimistic people. We all know people who are incredibly negative, and I try and avoid those people. And if you're someone who's trying to get through a difficult time and you've had a stroke or you have a disability, you don't need people around you who are negative. Now, one of my favorite quotes is that of Winston Churchill, who during World War II, and one can only imagine, I mean, he was in it by himself and being bombarded, and yet his quote was, "Never, never, never quit." And I actually wear a bracelet on my right arm, on my wrist, that has that quote on it. So to remind you when things are tough, to be realistically optimistic that you and your loved ones are going to need help, but establish what it is you can do, what it is you have difficulty doing, and then a list of those things that you just can't do. If you look at the list of all the things that you can do, I think you'll be surprised that that list is pretty long, and that you should feel really good about that. And you should be optimistic about the middle list, and the list is the things that you have difficulty doing. So look at that middle list of things that you have difficulty doing, and sit down with your family, your friends, and your physician and say, I need to work on this list of things I have difficulty doing, and set realistic timelines. So here's the first one. I'm going to try in this one and find out, okay, is that realistic to work on that? And realize that it may be at work, it may be with your family, and it may be leisure activities. I mean, and as mundane or trite as it sounds, you may say, well, things are good at work and good at home, but I'm having trouble. I'd like to get back to playing golf. I'd like to get back to playing tennis, to swimming. And those are realistic goals that you need to work on. So remember to be resilient, bounce back, but make that list of things that you're having difficulty with and start to work on them.